Hello, my name is Betsy Kasakapuram, and I'm going to be presenting my health education research paper. The topic of interest was lack of awareness regarding and access to gynecological care and contraceptives necessary for young adolescents starting to become sexually active. The target population was Hispanic females because of the additional healthcare barriers they face because of culture and race. To begin, Hispanic teenagers face discrimination within the healthcare field in terms of access and quality of care because of financial struggles, language barriers, and lack of awareness of the necessity. Specifically, for Hispanic females, gynecological visits may be seen as a secondary priority, and females may not be educated on the importance of getting reproductive health care and how to gain access to it. Furthermore, because of the largely Catholic denomination of Hispanics, teenagers who choose to become sexually active decide to keep it a secret from their parents, who would be their primary provider for healthcare. The chosen environment was Upper Deerfield Township, which is a part of Cumberland County. It's a small rural community of Cumberland County in which 46% of the total population is of the Hispanic ethnicity, 10% is ranging from 10 to 19 years old, and 50% is of the female gender. Healthcare access to residents of the small township is restricted to the following hospitals: Encompass Healthcare Rehabilitation Hospital of Vineland and the Inspira Health Medical Center. Unsafe sexual intercourse gives access to various sexually transmitted diseases and possibly unsafe pregnancies. Not going to annual gynecological visits or being aware of the signs and symptoms of sexually transmitted diseases put females at a greater risk of further complications with their reproductive choices in the future. Gynecological visits are important for after experiencing a health issue and for preventative measures as well. However, if not given a priority, gynecological visits can often be ignored. Three top researchers within this field is Dr. Glenn Flores, Vincent Guillermo Rames, and Allison Komorowski. Dr. Glenn Flores works out of the Medical College of Wisconsin, and Vincent Guillermo Rames works out of the Center of Latino Descendants, Adolescents, and the Family Health and the Silver School of Social Work at New York University. Allison Komorowski works out of the Northwestern University of Feinberg School of Medicine. By having a reproductive health class in high school available to all females of the student population, this health intervention allows for cultural humility as Hispanic students aren't being specifically targeted within the Upper Deerfield Township. This health issue can place this health intervention can place a spotlight on the health issue without specifically targeting one demographic by targeting all the students within the high school. The class will educate students on various sexually transmitted diseases, encourage the target population to take advantage of the gynecological services available near them, and allow the teenagers to make more informed decisions about sex and the necessity of using protective contraceptives. Reproductive healthcare classes in high school itself is essential towards educating individuals who are soon to become sexually active about safe sex practices, consent, contraceptives, and the signs and symptoms of sexually transmitted diseases. Awareness is directly correlated with behavior, and increasing the number of students taking this class will directly increase the amount of students that will again choose to get reproductive health care in the future. Information about this class will be spread through posters and infographics, which will introduce the innovative nature and importance of taking the class. By making students aware that this is a new class they can take, teenagers can make an informed decision to make this a part of one of their electives. A pre and post survey will be used to evaluate the effectiveness of the intervention. By providing a questionnaire that asks about reproductive health care and gynecological visits, the development of results will help evaluate if this intervention was effective. Now, for some appropriate upstreams, making older Hispanic generations aware of the importance of getting gynecological care so that they can pass the practice down to their children is one important step. Moreover, making offices more welcoming to immigrant populations and having Spanish speaking staff also helps patients feel more comfortable. Now, for some independent evaluations, Upper Deerfield Township was chosen because of the demographics and high Hispanic population percentage. However, there were a lot of roadblocks faced in terms of finding specific information about the community. Lots of information is found about the general Cumberland County. However, it's very difficult to find things specific to Upper Deerfield Township. So next time, more research will be done regarding all possible communities before choosing one right off the bat. Now, for level of expertise, in terms of the health issue and community, a strong foundation was able to be built. However, because of the aforementioned causes, there's still a lot to learn about the environment of Upper Deerfield Township. Now, for the health educator role, the role was fulfilled by drafting a plan to integrate a reproductive healthcare class in high school, and this allows for the health educator to identify the health issue and possible methods of reducing it. Now, for my intentions with the paper, because of Because variety of statistics were compiled together in this paper, the information can be broken down into informative infographics that can later be provided to the general public. Thank you all for listening to my presentation.